Good evening, Singapore. Good evening to our viewers across the globe. Welcome to Bayanihan Talks webinar series. I am Minnie Lau, the Honorary Treasurer of the Philippine Bayanihan Society, Singapore, and the moderator for tonight. Join me as we discuss maintaining health during a pandemic with Dr. Melissa Nadine Caraan, a medical officer at the Psychiatry Department of the Philippine General Hospital in Manila. Before we proceed, please allow me to introduce our Bayanihan Society here and give you a glimpse of who we are and what we do. The Philippine Bayanihan Society Singapore was officially inaugurated in August 2001. It is managed by a board of directors led by our President Emeritus Jenny Chua and Honorary President Ranveer Kumar Singh, and all are volunteers. We are housed at the Bayanihan Center, a 4-story building located at 43 Panjang Road, just opposite the Maple Tree Business Center and a walking distance from Labrador Park MRT. The Society is a recognized volunteer welfare organization and a member of the National Council of Social Services in Singapore. Our main objective is to promote advancement of education and skills and to provide a venue for the conduct of education and training and personal development programs for Filipinos in Singapore. Bayanihan Center, which was a former school, has classrooms. It is the home to Filipino Overseas Workers in Singapore, or FOWS, which offers courses in international cuisine, dressmaking, basic and advanced baking, and hotel and restaurant management, as well as computer technology, caregiving, and many others. However, due to the current pandemic situation, some classes have been conducted virtually and some with limited physical attendance. Next year, though, enrollment will open on Sundays from January 3 to March 7. We hope classes can be more normal as bigger number of gatherings will be allowed. The center is also home to Ateneo LSE program, or Leadership and Social Entrepreneurship program, and lessons via virtual platforms are continuing and going strong. The Society has been organizing Bayanihan Talks, which have now evolved into webinars like tonight's webinar. Besides classrooms, the center also has meeting rooms, a tambayan room, letter boxes, and a professionally designed photo studio that is available to OFWs in Singapore. We are also the team behind the annual Bayanihan lecture. A second one was held recently in August. The lecture aims to draw individuals who have contributed significantly in society and community service and to share their knowledge and experience and to inspire volunteers. We are also the team behind the popular annual Bayanihan Walk, which is currently on hold. I'm sure you understand that. But please look out for the Bayanihan Walk in 2021, which is being planned, which could be virtual or a combination of physical and virtual. So look out for that. I hope everyone now has a better understanding of what the PBSS is about and what we do. Please do approach us for any training or skill ideas or cultural activity suggestion. Contact our Bayanihan Center officers, Cecil and Mindy, for any inquiry. As everyone knows, the Philippines has been badly battered by 3 super typhoons over the last few weeks. Some people have died, many remain missing, and many more are suffering due to the massive floodings. They need food, they need clothing, they need medicine, and many others. For those who are keen to help and donate, there are many organizations in Singapore that have taken the initiative to organize fundraisings or collection of donations, both in kind and in cash. These include one organized by Filipino Association of Singapore, or FAS. It has a box at Air Freight Cargo for donations. Singfil, another organization, has a donation box at LBC. Alumni organizations such as the UP Alumni Association Singapore are also raising funds, which will be remitted to credited organizations in the Philippines. And there are many more, so please do approach them if you wish to help and donate. The topic today is indeed very timely. The COVID-19 pandemic will not be going away yet, but hopefully the promise of vaccine will be within our reach soon. This pandemic and other calamities, just as like the super typhoons that we have seen, and other calamities like earthquakes, can indeed affect our mental health. Our guest speaker, Dr. Melissa Nadine Caraan, will help us understand better on how to guard our mental health. She is a medical doctor and practicing psychiatrist at the Philippine General Hospital in Manila. The doctor has a Bachelor of Science degree in Family Life and Child Development, graduating cum laude from the University of the Philippines, Diliman. She then went on to pursue her medical study and graduated in 2016 as a Doctor of Medicine at the College of Medicine at the State University. Dr. Mel then spent the next 2 years as a Barrio Municipal Health Officer at Linapacan, Palawan, while pursuing another degree. In 2018, she obtained a Master in Public Management, a major in Health Systems Development at the Development Academy of the Philippines. The impressive and hardworking young doctor is now a medical officer at the Psychiatry Department of Philippine General Hospital. So without further ado, may I now call upon Dr. Melissa Nadine Caraan to take the floor. Dr. Melissa, please.
Hi, good evening po. Thank you very much, Ms. Minnie, for that wonderful and very generous introduction. So thank you. Before I begin, let me just say my great appreciation for the Philippine Bayanihan Society, Singapore, for inviting me to speak tonight. So thank you again, Ms. Minnie, Ms. Christy, Ms. Mindy, Ms. Cecil, and Dr. Makalingan. I will try to keep this talk as light as possible. And to begin, I have a simple question for everyone. Kamusta? Kamusta po tayong lahat? How is everyone doing right now? You know, I have used that question so many times to start a conversation. And prior to this pandemic, I always seem to get replies ranging from okay lang or I'm good. But in the past 8 months, or when the WHO declared the COVID-19 a pandemic, I've heard different answers to that simple question. More often than not, I hear frustration, anger, or fear, usually coming out of their responses. So for tonight, we will be focusing on mental health, especially in the time of pandemic and also in the time of disasters. Has it changed? How has it changed? And how do we deal with it? So a short disclaimer before I get started. The opinions and advice expressed in this webinar are those of the speaker and do not represent the views and opinions of the organizers and the Philippine General Hospital. The information provided in this webinar is for general information purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and cannot be relied on in place of consultation with your licensed healthcare provider. So here's a quick outline of what's in store for us tonight. We'll tackle common reactions to disaster or pandemic, the causes of these reactions and our stresses, who are the people at risk for mental health issues, what are the coping strategies that we need to maintain a healthy state of mind, And when do we know that we need to seek professional help? So after seeing these headlines about COVID and the pandemic, how did you feel? Did it bring back memories of earlier in the year when all of us were seemingly blindsided by this life-altering event that is the pandemic? Did you feel anything? Or because I'm pretty sure most of us did, otherwise we won't be tuning in right now. So again, how did you really feel? Do you feel like you're the only one feeling this way? In the next few slides, I will be showing you the common emotional, physical, and cognitive reactions that we can experience because of this pandemic and of disasters. First, we have the common emotional reactions. First is sadness. A lot of people feel sadness about the pandemic for many reasons. It can be because of being directly affected by the virus, or that the changes in normal life cost them either their job, their routine, and some even their personal relationships. Many of us also fear of contracting the virus. For us healthcare workers, it's fear of bringing home the virus. We fear about our lives, our families' lives, and the future. A lot of us feel an increase in anxiety or worries. How can we not worry when there is so much uncertainty in the world right now? It's difficult to plan ahead. If there's anything that this virus has showed us, is that life is indeed very short and that it can be taken out in a snap. And last but not the least, some of us feel anger. We are angry for the poor response to the pandemic by certain institutions or for the restrictions that have been stringently imposed since March. We also have physical reactions to stress. Some of us may feel more than the usual headache or stomach ache. We also have joint or muscle pain. And some of us feel very, very tired and exhausted for no particular reason. Now, these added physical reactions add to our stress and sometimes even paranoia. How many of you have woken up with a headache and immediately thought and prayed that this is not COVID related? Personally, I've had times when I felt really tired and I have joint pains despite not really exerting a lot of physical effort in the past few days. And I would ask myself, is this COVID? And then later on realize that I felt these body pains prior to my COVID duties in the hospital. Now, aside from emotional and physical reactions, we also have cognitive reactions to stress. Stress can change how we think. So for some people, when they are under a lot of stress, confusion kicks in. Have you ever been in the position wherein you're nearing a deadline and you are nowhere near completion? Do you remember during those times when even just the day or the week seems so confusing for you? Nakakalito, di ba? Kapag ang dami mo nang iniisip. And for others, they can be very forgetful. When there's too much on your plate and things seem overwhelming, we become forgetful. How many times have you forgotten where you placed your cell phones during your most stressful moments? And during the start of pandemic, I remember being forgetful of where I placed things in my tiny studio apartment. And those forgetful moments happen during my COVID duties, the most stressful duties for me. And then there's guilt, usually inappropriate guilt. I'm sure the healthcare workers tuned in tonight can relate to me when I say that I have never felt more guilty to come home because I am fearing not only for my life, but for my family's life, that I may be bringing home the virus. So whether you feel anxious, sad, or angry during this pandemic and during any disaster for that matter, I want you to know that you are not alone. Hindi ka nag-iisa. The stress that you're feeling now, whether it comes out through your emotional reactions or you observe more bodily or cognitive symptoms, are the things that we all go through somehow, just with different degrees and intensity. It is fine to feel sad or anxious or angry. We have every reason to feel this way during this pandemic. And there is a way to make this better. But before we even go there, maybe some of you are asking, why are we even feeling these things? Why are we all so stressed? Most of us are at home anyway, so why the sudden increase in stress? According to several researches, here are the usual causes of stress in this pandemic. First, of course, is the fear of the virus, fear of getting the virus and fear of bringing the virus home. The fear of the virus kicks in the moment you open your door, be it to get a delivery or just to go out. The virus is new and something that we came relatively unprepared for. Next, the change in routine has also thrown a lot of people off path. We follow certain routines because it is time efficient and familiar. Kung alam mo ang lugar, gamay mo ang daan. Kung bago ka, mangangapa ka, mas-stress ka. That is the comfort of routine. We know where we'll go, what time we'll go there, what time we'll arrive. That is routine, and that comforts us. And when that established routine of getting up in the morning, preparing for work, going to work at specific times, all of those suddenly change, we get confused, sometimes disoriented, and mostly stressed. Part of the change in routine is our current work or study from home setup. Who among you have had to deal with setting up your room as quickly as possible for your room to look presentable when the boss asks everyone to turn on their videos? Or the sudden need to have laptops and printers and a good internet connection just to be able to study from home? The work or study from home setup has almost erased the line between work and personal life. Our bedroom, which was usually our place for relaxation, has now become our place of work. And it seems like with this current setup, rest is harder to come by. With less time for relaxation, the more stressed we become. Another definite stressor during the time of pandemic is the unwanted social isolation it has created. We have lockdowns in the Philippines or circuit breakers in Singapore. The extended period of time that we are forced to stay in our homes has greatly affected our mental health. We are all social by nature. Sabi nga nila, no man is an island. But during this time, we were forced to stay alone. I can only imagine the difficulty our OFWs have to endure in Singapore and in other parts of the world. It's hard enough to leave your families behind, but I'm sure it was even harder just thinking about the possibility of going home because it was almost impossible. I had a patient in PGH who spent 2 months just trying to catch a flight back home. It was a long and expensive journey that she needed to go through because her employer couldn't afford to pay her because of the pandemic. Which brings me to the next cause of stress in the pandemic. Financial instability is apparent. The pandemic has caused our economies to stop, and this has caused a lot of businesses to stop operating, and therefore a lot of lost jobs. Losing a job is very stressful in itself, and that is increased by the threat of a health problem because of the pandemic. In the Philippines, it's quite costly to even get yourself tested. What more to get yourself admitted for COVID-19? And lastly, the uncertainty of everything right now is a very, very big stressor. It's very difficult to picture how our world will look like in the months to come. Can you imagine going back to how we used to travel? In Singapore, the virus has been very well controlled. But you see news coming from the Philippines or in the US, and you see that it's a different story elsewhere. The end of the tunnel seems too far away. And when things of this magnitude are uncertain, it becomes harder to plan ahead, to foresee events, and to look forward to vacations. Because really, when can we absolutely be sure that it's safe to go out? And when we say the new normal, what is it really? Who knows what the new normal is? So aside from these stressors, there are several factors that have been identified in studies that may put one at risk, at an increased risk for mental health issues. First, of course, are those with existing mental health conditions. Some of them have had difficulty getting access to their doctors, their therapists. They can't get medicine. And this increases their risk for symptom relapse. And then we have people in the lower socioeconomic status who are the most at risk for the financial and economic crisis that we are in. Also, people with poor social support, those living away from family, for example, are also at risk because when one has to deal with the stresses in life, a good social support often keeps us afloat. Our situation now is a very stressful time, and having little to no social support may cause one to even feel more alone than before. Next, we have frontline workers who are also at risk for mental health issues. These are the healthcare workers, the police, service providers that continue to go to work and get in contact with a lot of people, and they are the highest risk to contract the virus, and this can cause an increase in anxiety. And lastly, those people with high social media exposure are also at risk. Yes. You know, when you're on Facebook 18 hours in the 24 hours a day that we have, you are at risk of getting a mental health issue. Because number one, fake news are abundant in social media. It's quite difficult to filter which is correct information versus which is not. The misinformation will provide us only with conflicting ideas and only adds to the uncertainty of the time and hence an increase in stress and anxiety. So, how do we deal with all of those? If you're a cashier at the grocery whose finances are not the most stable, yet your anxiety is very much heightened because of the virus, and you don't have another choice but to continue working, how do you cope with all of these stressors? So these practical tips I will be speaking of are actually from the World Health Organization, and I took the liberty to tweak some of it as I see fit for us Filipinos, both in the Philippines and abroad. So first is to establish a routine. One of the first things that got disrupted when the pandemic started is our routine. To regain some semblance of normalcy despite the new situation, we have to establish a routine that includes a time to do personal hygiene, eating healthy meals, regular exercise, and proper allocation of time for work and rest. What happens with some of us who are in a work from home setup is we tend to neglect the basic things. Naku, I won't take a bath, hindi naman ako papasok eh, wala naman makakaamoy sa akin. Diba? Or because we are at home, some will feel the need to work overtime. But we have to remember that in every minute or hour that we spend more on work, those are time subtracted from rest and relaxation. So we don't have to be 100% productive every single time. We need to pace ourselves because it can get exhausting. We need to balance work and rest. Next, of course, is keeping informed. We need to read or watch news from reputable sources. If you read your news on social media, make sure that the source is from the big news companies because they have a mechanism for fact checking. If unsure about your source, we all know that we have a friend we can rely on. Mr. Google is always that friend to check the legitimacy of a Facebook page or a website. But as with my previous slides, we cannot always check the news. They say too much of anything is bad, right? Same goes with this. Let me tell you a story. During the first 2 months of the pandemic, I followed news outlets on social media every single day, as well as the daily news updates of our hospital regarding COVID cases in the Philippines. Every night when updates are posted, I seem to have gotten obsessive to the point of checking the numbers if they add up. Parang mali, parang dati, parang kahapon plus 10 na yan, bakit nabawasan ng 30 ngayon? I was always adding the numbers and it was stressing me out. I was informed, I knew the numbers by heart, but I was very, very stressed. It was engulfing me, and during that time, I probably gained 10 to 15 kilos because I was eating more than I used to. I was stress eating. Now, I limit my COVID news intake to just once a week, and that has increasingly and significantly lessened my stress. Next is to get connected. Never have we been more physically apart with our family, friends, and workmates than today. Initially, the social distance required of everyone seemed like a reprieve from all the social gatherings that can be quite tiresome. But as the weeks and months came by and we were still required to keep ourselves cocooned in our homes, we felt the increasing stress and anxiety of not being able to see, hear, and touch our loved ones. As I have said earlier, people need other people. And this pandemic showed us that, so we shouldn't hesitate to drop a message to a friend, say hello to that coworker, and call your loved ones. Just a simple kamusta or how are you is enough to brighten our days. We may not be able to hug and beso our friends like before, but at least the technology has allowed us to get connected online. Another strategy to minimize, if not stop alcohol completely, and as well as your other vices like cigarette. Alcohol can either relax us or lessen our inhibitions. So when we are stressed, our body is on hyper mode and we are so tense. Nararamdaman nyo yung mga kasukasuan nyo parang halos naninigas. Now, when one drinks alcohol, we are able to relax. But then the relaxing effect can also get different. We can get very disinhibited. Or in Filipino, we call it nawawalan ng hiya. So depending on our environment, that disinhibition and the momentary lapses in judgment brought by the alcohol can bear mistakes that will just aggravate our already stressful situation. So aside from changes in our behavior, it can also have long-term side effects for our body. Like the liver or the brain can be affected if you drink too much alcohol. Now, if you have hypertension and diabetes, drinking alcohol may also worsen your condition. So during this stressful time, it is best to have a healthy state of mind. And how do we do that? By first and foremost, having a healthy, physically healthy body. And last strategy is do not discriminate. You're probably asking, well, why are we asking this? Why are you putting this? Do not discriminate. Kasi di ba, nung mga unang buwan ng pandemya, nagkaroon tayo ng problema, lalo na sa Pilipinas. Meron tayong nakikita ditong mukhang galing sa ibang bansa, baka COVID yan. But we shouldn't discriminate. You know why? Because the virus does not. COVID-19 does not care whether you are rich or poor, educated or not, Tagalog, Bisaya, Ilocano, whether you're Filipino or a foreigner. So if the virus does not discriminate, neither should we. The entire world has been greatly affected by the virus, and the only way to move forward is by uniting our efforts towards a pandemic-free world. The war is against the virus, not with everyone else. An additional note for our parents tuning in and to lessen the stress of the household, a good coping strategy is to maintain a routine for the entire household and not just for the adults. Wake your children up as if they are physically going to school. In that way, they would also know that when it's their school time, it's also your work time. We also need to discuss the coronavirus with our kids. You may think that it's too complex for them to understand, but children are very, very smart. If you explain to them the idea of COVID in a manner that they will understand, let's say we use Peppa Pig to demonstrate how the COVID-19 affects everyone. They can and they will understand. And lastly, as much as us adults should learn how to identify and verbalize our emotional reactions to this pandemic, our children should too. Help them discover ways of expressing their feelings. Some parents I know use emojis. They print out mga emojis and then it helps their toddlers identify what they're feeling, what their emotions are. So that's something the parents tuning in might try in the future. Now, if you are an older adult, you should acquaint yourself with the technology because most of our needs can now be accessed with the touch of our phones. You may reach out to the younger generation to help you with ride-hailing apps, food delivery apps, and other online transactions that you will be needing during your daily lives. And also to lessen your chances of getting the virus when you go out to your bank. For the people out there who have existing mental health conditions, if you have been receiving any kind of treatment, it is important that you continue your medication as prescribed. If you can, seek a follow-up consult with your psychiatrist or your therapist and reach out to your support group, be it your family, your friends. You don't have to go through this alone. Now, if you've gone through all the strategies mentioned and you feel that it's not working, it may be time for you to seek help from a mental health professional. So what can alert us that we need help and that we're not just experiencing the normal feelings of sadness, of anxiety, and of fear? First, you feel overwhelmed by your emotions, that it keeps you up at night and you find it hard to perform at your usual level, whether at work or in school. Next, you may be having thoughts of harming yourself or harming other people. You may also have excessive fear or anxiety that is accompanied by palpitations, difficulty of breathing, you're sweating profusely, your tremors, nagtatremble and nanginginig-nginig ka na. Some patients describe it as having heart attack. And some can even have nightmares or flashbacks about the situation, which causes distress for prolonged periods of time. Sobra na silang nananaginip ng masama, ayaw na nilang matulog. So if you are currently having any of these symptoms I mentioned, or you just feel the need to talk with a professional, do not hesitate to seek help. Now, you may ask, where can we get the help that we need? I checked some news articles from Singapore that took a list of mental health services, and I saw that some churches offer counseling for free, like the Family Life Society has free counseling, but is by appointment only. There is also the Aware Helpline for those who are not yet sure about seeking help in the clinical setting, but finds the need to seek help through voice calls. There are other services that that offer online counseling for a fee. Now, if you're in the Philippines or you know someone in the Philippines who need professional mental health, there are free mental health services like the National Center for Mental Health Hotline, the Philippine Mental Health Association online counseling, the In Touch community crisis lines, and with us in the Philippine General Hospital is our outpatient clinic. Now, these free mental health services are available online, but maybe you can just expect a longer waiting period because there's quite a number of patients wanting to be seen. So if you think you or your loved ones need help, please do so. I understand that for some, seeking help is scary, especially given the stigma of mental health illnesses. Baka kapag sinabi mong magpa-check up ka sa psychiatrist, sasabihin ng iba, bakit? Baliw ka ba? Diba? Yun yung una kasi mga tinatanong. Pero seeking help, seeking a conversation with a therapist or a psychiatrist, sometimes it's just that. You just want to converse. You just want to talk. And as mental health professionals, our aim is to provide you a safe space for your thoughts and emotions. In our consultation, it is free of judgment. And whatever we say is done with compassion and empathy. So if you want to seek help, these are the lists of mental health services that are available in Singapore and in the Philippines. There are online lists that you can check. If you need more, if you're not from any of these countries, you can check online, but please do seek help because we are willing to help. We will be listening to your problems, your thoughts, and your feelings, and we will try to go through them one by one as we move forward and try to regain some semblance of normalcy in this time of pandemic. So thank you very much for listening. Here are my references for tonight's lecture. I will be more than happy to answer some questions if you have any. Thank you.
Thank you, Dr. Mel. May I now, we actually have a guest moderator to under the Q&A. May I please call? It's our honor to call Dr. Eugene Makalingap. Dr. Eugene Makalingap, can you please take over? It's yours.
Thank you, Ma'am Minnie, and thank you to the rest of the officers of Bayanihan. So magandang gabi to everyone. Magandang gabi, Dr. Mel. Thank you for that very comprehensive discussion on mental health issue. Okay, so we do have some option for you to ask question. You can post it on the Bayanihan Facebook page, or for those who are joining us on Zoom, you can also switch on your microphone, or you can drop your question on the chat box and then I will try to read it. Okay, so I just saw one comment from one of our viewers, from Mary Grace Sabandal, and she said, pandemic make us totally sad. So we can really feel the sadness in her message. Okay, so Doctor, you mentioned about seeking for help, right, professionally. And we're grateful that you listed both counseling opportunity both in Singapore and the Philippines. So one of the question here is that how can our kababayan convince their family or their employer that they really need professional help? Because as you mentioned, some of these are still taboo. Some of them, they're not really open-minded about talking it up front. So what can you recommend if somebody feels that they need professional help? How do they convince their loved ones or their employer that they really need professional help?
It's quite difficult actually to convince other people about your mental health issues. So if you can do it, just say it to another person and just your seek consult for the first time and help that mental health professional, be it a psychologist or a psychiatrist, explain to your family or to your employer what you're going through. I think it will be the best option at this point. I've had patients who go to me alone, and what we do is after our first or second session, we talk with their family to explain what's going on with them. And that usually helps the family understand what they're going through. For others, when you see consult kasi, di ba, with a mental health professional, you can get a medical certificate, and that is proof enough, I think, for most employers.
Yeah, thank you, Doctora. So, is it helpful that they start talking it little by little, as opposed to just they suddenly explode and they realize that
Yes.
they're already in a very precarious situation?
Yes. Yes po. Opo. Uh, if, for example, you're thinking about seeking help right now and you're not sure how your family or your employer will react to your plan of seeking help, then maybe you can drop hints from time to time about possibly seeking help so that in a month or two, once you finalize your appointment schedule with your chosen mental health professional, then it will be easier for them to understand what you're going through and why you need that help.
Thank Doctora, we missed the last part you were saying.
I'm sorry. uh we can drop hints like if you're planning to seek consult, usually kasi there's a quite a long time waiting time for appointments with the mental health professional. Like in our hospital, there's already a month of waiting. So if you get an appointment today, you can drop hints for the rest of the month with your families or your employers, explaining to them why you probably need a mental health professional to help you with your issues. And that will hopefully lessen the shock, if ever, for your family or your relatives with your decision to seek help.
Thank you, Doctora. Okay, so this next question, it was sent to me via WhatsApp. I do have some friends who are working in the hospital here as nurses and doctors here in Singapore. And you yourself, Doctora, being a healthcare worker, you mentioned that you started or you stopped looking at COVID news on a less frequent basis. I think that's also a good advice for a lot of healthcare workers. But in your experience, what would be the most common stress and mental health issue that you've dealt with some of the patient that you uh, treated?
It's really the difficulty of adjusting to the situation, both for healthcare workers and patients themselves, those who got COVID. It's the social isolation that we continuously face, especially when we're directly working with patients. We need to isolate for a time before we can go home. So it's the difficulty in adjusting that increases our anxiety. And for some, the prolonged periods of isolation brings a lot of sadness, even to the point of depression.
Thank you again, Doctora. Okay, so again, for those who want to uh, ask question, okay, we're available on the Bayanihan Society Singapore homepage, or you can drop your question on the chat box here in Zoom. Okay, so I have one phone-in question here for you, Doctora. So you've mentioned in your talk, Doctora, that lower socioeconomic group and those who are frontliners and those who have high social media exposure are of higher risks for mental health issue. Do you have any specific advice for those people who are in this group, or they know people who belong to this particular group?
Uh, for healthcare workers, for one, I think it's important for us to get connected with our loved ones despite the isolation that we usually go through because of COVID. So if you're working in the hospital, most likely you're inclined to not stay at home most of the time because you're afraid to bring home the virus. And for people in the lower socioeconomic status, I think that's the most difficult to address at this point because it takes the system to help them keep afloat their finances, especially in this time of economic crisis. And for those with existing mental health conditions, it's very important to uh, keep medicating if they are on medications. And I think a lot of mental health professionals right now are online. They are shifting to telemedicine, teleconsultation. So it's, I think, easier to seek help if they wanted to.
Yeah,
And
just
always have the time. Just get a time for yourself to relax and enjoy. You What I saw from March to, let's say, June, are people trying to get very productive despite the pandemic, doing a lot of things at home. And minsan may competition pa on social media on who does more during the quarantine. But that adds to our stress. So if you can keep it in your minds that you don't have to be 100% productive all the time, it will also help lessen the stress.
Yeah, that's a very good comment, Doctora. But like in Singapore, people are very workaholic, and it's so hard to. And also, doctors, like everywhere in the world, are very workaholic. Our nurses, our doctors, okay, our kababayan who are based here working, right? So, what would be a practical tip to tell them how to relax? Like simple things that one can do to relax.
Simple things that one can do to relax is to be mindful. Okay. For example, you're showering, you're in the bathroom. You take time to lather your hair with the shampoo. Every time your finger touches your hair and you feel the bubbles of the shampoo, you feel it. Okay, so you take time to do your shower routine in the morning or in the evening if that's what permits your time. And when you're, let's say, when you're drinking your coffee, take time to appreciate the color. Is it really black or is it more brown than black? And check how the smoke of the coffee lifts from the mug. That little thing, just 3 minutes of your time, can relax you. And I think most of us have 3 minutes at least in a day.
Doc Eugene, nawala ka ng mic. Doc Eugene.
Doc Eugene? Doc Eugene, we could not hear you. Sorry po, Doc Eugene. Doc Eugene. Sorry, Doc Eugene, if you can hear, we could not hear you. Sorry for that. I wonder what she was saying. Anyway, while Doc Eugene is trying to check on his mic, there is a question. Dr. Mel, if
Yes po.
yes, there's a
Mike.
okay, there's a question. If I may just while Doc Eugene's trying to check on his mic, technical issues come now and then, they happen. There's a question from our Facebook page from John Rosado. He says, hello to Dr. Mel and all. He missed the session and came in to watch late. Was there a presentation or slide of the top 3 reasons for people transitioning or developing into mental concerns during the pandemic segment in time? And then top 3 signs and symptoms for this transitioning. Thank you.
By transitioning, he might have meant yung transitioning to a mental health condition, not just the normal. I think, would he want me to flash my slides again?
Well, yeah.
Okay. I will. So here are some of the symptoms that we should be watching out for. So when you have overwhelming emotions and usually you're not able to sleep because of those emotions, and you see yourself not being able to perform at the usual level in school or in work, that's one of the things to watch out for. When you're having thoughts of harming yourself or other people, that's also a warning sign. Okay? And some patients experience panic attacks. So that's when you feel palpitations, difficulty of breathing, you're sweating profusely, and you have tremors. And usually these panic attacks, they come out of nowhere. There's no triggers that people can identify. And some people even have nightmares or flashbacks. Like, example is when patient was isolated for some time because of the virus, and he recovers from the virus and comes home. There will be times, some of them will have flashbacks of being alone in the hospital. And when that flashbacks occur so many times that it distresses the person, it causes sleepless nights and excessive anxiety to the point of not wanting to go out of the house anymore. It debilitates them. Then that's a time that we should be looking for help with our mental health professionals. So there are a lot of symptoms. We cannot say which is the top 3 symptoms, but once the stress of the pandemic is too much, meaning anytime a person says, I think this is too much, that's a sign that you probably need help. Not to tell that you have like depression or anxiety disorder, but just to be able to listen to your worries and concerns that some of our families or friends may not be able to listen to as we would have wanted, because everyone is going through the same thing. So sometimes people tend to not share a lot about their worries and fears because iniisip nila, ito rin siguro yung nararamdaman nito, hindi ko na lang ikukwento. So if you're feeling a lot of those thoughts and you can't function as you used to, I think that's a telltale sign of probably needing a professional help.
Thank you, Dr. Mel. Apologize for the IT difficulty. So, before I proceed to the next question, I'll ask a question that is very close to my heart. Because as healthcare workers, we had to transition to online teleconsulta, and some of us who are teaching also had to do online classes. And of course, we have to communicate with our loved ones, okay, across seas. So my issue is that we get stressed sometimes with IT difficulty, just like what just happened a moment ago. So for I'm sure you've had a lot of similar experience. So what would be your practical tips when it comes to, using this gadgets and like IT issue?
Well, this tip I got from our ophthalmologist friends. Uh, we have this 20 20 20 20 20 rule. So for every 20 minutes that you are on your laptop or on any screen, you take 20 seconds to take your eyes off the screen. So after 20 minutes, take a 20-second rest and look ahead of you for around 20 feet or just look far enough because according to them, it's the position of the eye that relaxes our eye muscles. So of course, when the eye muscles are not as strained, they are relaxed, there's less likely for us to have headaches. Kasi yung headaches, usually, it stresses us out na eh. Because it's difficult to function, difficult to think properly when you have headaches. Now, for the IT difficulties, what I usually do is I have several options. So before I face a patient, I make sure that my internet is ready. If not, then I get the option of calling the patient instead. So there's no internet problems. And I do multiple platforms just so we have options because some platforms can operate with very poor internet connection while others need the best internet connection.
Thank you, Doctora, for that very practical tips. I will practice what you've said, the 20 20 20. Okay, so let me shift gear a little bit. And uh, Mom Cecil from Bayanihan has a question. And her question is, as a parent, how do I talk to my children about the coronavirus without making them anxious?
Meron pong available ang World Health Organization na parang children's book about coronavirus. I think that's very helpful because they come in cartoon forms. The usual children's book stories. And so that's one strategy to help them learn about coronavirus. We can just talk about how to not get the virus, like just the proper hand washing techniques, how singing two happy birthday songs while washing our hands, and how to cough, the proper cough etiquette. I think that's a good enough strategy to teach them about the virus.
Yeah, so Doctor, just a quick question. Kasi here in Singapore, those who are 2 years old and below, they're not mandated to wear masks. But
Masks. Oh.
yeah, but after but 2 years old and above, they're mandated to wear masks. And I'm not specifically aware of what is the ruling in Philippines, but for us, some of our kababayan, they take care of their employers' kids, and some of our kababayans also have kids here in Singapore. So sometimes it takes a while to explain them why they have to wear masks when they're going to school or when they're going out. So any good strategy that we can employ to tell our kids or our employer kids what's the benefit of this, and how it can protect others as well.
So this I saw on social media. They do what do you call this? They get a candle and they try to blow the candle while they have their masks on. So we can try that with our kids. So ask them to have their masks and have a candle in front of them, and then I'll ask them to blow the candle, and they'll see if they're wearing their masks properly, that they won't be able to blow the candle. So that would be a good starting point to tell them that, this is why you wear the masks. Because when we speak, when we yawn, there's air coming out of our mouths, and that air may or may not have the virus. And we don't know if the other people has that virus as well. So we have to get ourselves protected so you won't get infected. Kasi very visual ang kids po eh. So I think yung ganong simple activity can teach them na, this is why we have masks.
So we really have to be patient and explain to them.
Yes,
Yeah.
opo.
And sometimes we have to do it multiple times because they
Yes.
keep on forgetting. Yeah, thank you, Doctora. Okay, so we do have another question from Sir Ed from Bayanihan. And this question is to Dr. Mel and Dr. Eugene. Are mental health or psychiatric issue usually covered by insurances in the Philippines and Singapore? So you go ahead, Doctora.
In the Philippines, I'm not too sure. I'm with PhilHealth. It's not yet covered po eh. But fortunately, we have a lot of free mental health services in the Philippines. And when you have the proper certificate and you can get the person with disability ID, then you can get discounts for your medications. Aside from that, it's more an out-of-pocket expense po talaga.
So, Doctora, but if the mental health becomes very symptomatic, right, and there are other symptoms involved, that can be potentially covered by insurance or PhilHealth.
PhilHealth, yes po. They get covered when they get admitted. Let's say, for example, at the Philippine General Hospital, if the patient has PhilHealth, he won't need to pay.
Yeah. Okay. Thank you. Well, briefly in Singapore, I think if you have a MediShield life coverage, that would be covered. And I think similar to Philippines, there is also here for mental health issue, it's IMH that specialize in that, and normally that would be covered by insurance and by government. Right? But again, when you subscribe to a particular insurance coverage, you can always ask your insurance agent before if this is covered. Yeah, so that's my short answer to that. Thank you, Sir Ed, for that question. Hopefully, Ma'am Minnie, we still have two more questions here. So I'll just proceed. Please cut me out if we're over time. So just one of the question here, Doctora. Having experience working in both big city, which is Manila, where PGH is, and working in small town because you are from DTTB. Am I right, from Dr.
Yes po.
Tudabario? Okay, so how would you compare the mental health issue of people who are from the city and from the small town? And this is very true also for Singapore because it's a big city here in Singapore.
Number one, the biggest difference I think is the acceptance of mental health issues. It's definitely more accepted in the bigger cities than in the provinces, and people are more aware in the city, so they seek help more than the ones in the rural areas. But probably one of the bigger reasons why the people in the provinces are not as aware is because there are no mental health professionals. For example, in Palawan, I used to have patients with mental health conditions, and I actually didn't know how to handle them, and we have no psychiatrists in Palawan. So it was very difficult for them to seek help. They had to fly to Manila or ride the Roro going to Manila just to get medication.
Thank you, Doctora. Okay, so Minnie has a question here. Okay, so if a loved one has been diagnosed with depression, how can we help? Or even when some symptoms are showing, but there could be denial, how can we help? Is there any medication that can be recommended?
So for the first question, how can you help if a family member has been diagnosed? The simplest answer is to be very accepting and caring. Meaning, if they're having difficulties going out of bed in the morning, which is very, very usual for people with depression, you don't tell them, tinatamad ka na naman, no. You allow them to take that 30-minute more bedtime and allow them their space and time. For relatives who are not probably in denial, that's I think that's one of the more difficult things to resolve. Is it's difficult to bring them to seek help if they themselves are in denial. So what we can do is to really just be there, listen with the intention to understand, not listen with the intention to correct what their thoughts and feelings are. Because at the end of the day, what their thoughts and feelings are, they are valid. No matter how privileged they seem from the outside, yet they speak of having depressed mood. We don't invalidate them. We don't tell them na mali yung nararamdaman mo, because we have every reason to feel those emotions. And I think that's one of the difficulties with us, specifically yung mga tayo pong mga Pinoy. It's easier for us to be happy or even angry, but it's almost uh, bordering on bad kapag naging malungkot ka, kasi dapat maging masaya ka lang palagi. And it's difficult for others to accept that we can get sad, yet despite all the richness that we have, we can get sad. So those emotions are valid, and if you keep it in mind that what your family member is feeling is valid, and that you allow them to feel that, and make sure that they're taking their medications or getting their consults with their therapists, then I think that is enough.
Thank you, Doctora. Such simple words, but very powerful, accepting and caring for our loved ones. Okay, so there's a comment from our Facebook page, Miss Tessie Usman Lilangan. Okay, a very interesting topic today. Thanks for this kind of webinar. So, and another question from our social media, and this question is about social media. Since you talk about social media, Doctora, how much should we spend for social media? Any specific social media better than the other? Which one gives less stress than the other?
How much time do we need to spend on social media? Well, if you can do an hour per day, I think that's a good start. What social media platform is better than the other? I'm not sure if there's such a thing as better than the other. If you like entertainment, if you like watching, then probably you'll choose YouTube over Facebook, because if you keep on scrolling through Facebook and trying to see the videos that you want to see, you'll probably see other posts that can be distressing. Whereas in YouTube, it's always the YouTube recommended video. So maybe YouTube is the less stressful one. Or maybe I'm biased because I also watch a lot of YouTube videos.
Yeah. So is it better to see like 140 characters on Twitter and then press it if you want to see more, or on Facebook where you can see everything? It could be fake news, it could be misinformation or disinformation.
I think the problem now is even in Twitter, there's a lot of fake news nowadays. And what Twitter lacks in number of characters, na ang daming emotions naman on Twitter. Sometimes yung Facebook, lengthy posts. And if you don't have the time to read, then you probably won't get as stressed. But in Twitter, just 140 characters of all capital letter rants or expletives can be very distressing. So it's difficult to say what's better, Facebook or Twitter. Well, maybe just limiting the time is the best way to lessen our social media exposure.
Would you recommend TikTok, Doctora, to de-stress?
Actually, the short duration of videos on TikTok can be very relaxing, and swak siya sa sa umiiksi na natin minsan na pasensya. So very entertaining in TikTok videos. So yes.
Yeah, thank you, Doctora. Miss Minnie, please allow me one more question because this is related to the coming Christmas and many of our kababayans cannot travel. So, and you mentioned, Doctora, that we should stay connected. So, any advice on our kababayans who cannot travel and they cannot do face-to-face meet up? What would be a good alternative? And in this alternative, what can they do?
Uh, if you can do video calls, I think that is the best option at this point, because it's important to see the other person you're talking with. It's always communicating is not just hearing the other person, it's also seeing and touching. Now, the pandemic caused us to not be able to touch. So at least we can see and hear each other through video calls. So I think that's the best platform that we have right now. So if you can do video calls, and you do video calls as if you're with the other person. So if you want to eat, maybe you can eat both of you while on Zoom or any video call platform, and just enjoy the company despite the distance. I think fortunate na rin tayo in this time because of these technology that we have. At least we are able to bridge the physical distance that we are experiencing.
Thank you, Doctora. I mean, just connected to that eating thing, yeah, as ulit ni Sir Ed. Okay, is there any food type that is with a link between mental health? Is there may food ba na magpapasaya? I'm sure this is a big topic, Doctora, but is any food na nakakapagpasaya sa atin or nakakapagpalungkot or that affects our mental health? And if meron, what can you recommend po?
I think kung ano yung na-enjoy mo, any food that you enjoy. Kasi I might tell you that you eat chocolate to enjoy, but some people do not entirely like chocolate. So they won't get as happy as I am while eating it. So you eat the food you like, but always in moderation, because you don't want to see yourself after 2 months 15 kilos heavier and with an increased risk for contracting the virus. Because as we all know, uh, having being overweight or obesity is a great risk factor for having severe symptoms for COVID. So we don't want that. And for food that can make us sad, well, well, alcohol does not really make us sad, but the aftermath of alcohol, the hangover that we feel can make us stressed even more. Kasi masakit sa ulo, sumusuka ka, wala kang ganang gumising sa umaga after mong mag-inom. So it will stress you out even more. So maybe that's one of the best things to keep away from your refrigerator or your shelves, or alcohol.
Yeah,
And
and
if you can, drink a lot of water.
mm. And Doctora, correct, like if you're already feeling sad and you have like some issues that are unresolved, normally alcohol and vices will not really help in the long run. It might you might feel numb for a while, but after the effect is gone, the issue is still there, right?
Yes po.
Yeah. So, yeah, this is beyond my authority na. Pero may one more question pa talaga na gustong humabol from Luz Mecenas. Kasi maraming nag-online ngayon. So, to spend more time. Pero minsan we do have jealous friends na bakit siya merong ka-Zoom mo siya, but ako hindi mo ka Facebook Messenger, wala kang time sa akin. So, any advice on possessive friends online? I mean, yeah.
Maybe we can give them time if we have. Or ito, Zoom is a very good platform for multiple calls, diba? So we can see each other through Zoom anytime. Even I think Viber has group calls. A lot of social media apps has meron namang multiple calls na kaya. So you can do that. And of course, you can always tell them na, no, you're a good friend. Just validate their feelings na you are actually a very good friend. It's just that you don't always have the time because yung mga work from home setup natin for some reason mas mataas ang demand from our bosses. So that's a good explanation for some of our clingy friends. But if our friends reach out to us and ask us why you're not talking with them, I think that's a good sign that we need to talk with that friend.
Actually, Doktora, pwedeng mag-watch party or mag-group session sa Zoom.
Yes.
Tapos
Opo.
hindi na nga traffic, di ba? So at least mas madaling to be connected with our loved ones.
Yes. Walang reason to be late.
Yeah. More power to you, Doktora, and PGH. One of the comment of another of our viewer from the Facebook page of Philippine Bayanihan Society. So I'll turn it over to Ma'am Mini. Sorry, Ma'am Mini, nag-enjoy kami masyado ni Doktora. I'll pass it to you. Maraming salamat.
Okay lang yon. Enjoy din kaming nanonood. So thank you so much. Thank you, Doktora Mel and Dr. Eugene, syempre, for sharing your knowledge and expertise and all these discussions. Syempre, iba yung tingin ng mga doctors at iba yung tingin naming mga hindi doctors. So that has been very helpful at madami kaming natutuhan. Ako madami akong natutuhan. But before we end, I would like to call and invite Ms. Christy Vicentina, our PBSS Honorary Vice President, to deliver the closing remarks. Christy, please.
Oh, yan. Tama ka na, Mini. Fine.
Sorry, pasensya na last time. Nabasa ko treasurer kasi yung pala hindi. Sorry, go.
Thank you. Good evening to our friends and kababayans in Singapore and to our friends and families in the Philippines. Mabuhay. On behalf of Philippine Bayanihan Society Singapore, allow me to say thank you to the people who helped us for tonight's webinar. This is our 12th already. I want to say thank you to Dr. Nina Jane Minette de la Cruz. Thank you for the introduction to our guest speaker, who is your very good friend, and for suggesting this a very useful and timely topic. And syempre, thank you, Dr. Melissa Mel Nadine Caraan. Maraming salamat. Thank you for the very timely and truly important sharing. Maraming salamat for instantly agreeing to share your expertise, even with short notice. And we look forward meeting you in person when the air is clearer. I'll definitely see you. I'm sure this will not be the last also for the collaboration on same subject or even different subject. And allow me to share that the doctor is a member of Mu Sigma Pi sorority from UP Manila. And their team have been doing volunteer activities for frontliners despite they're frontliners themselves, despite the ongoing loads as frontliners themselves. Hindi yun madali na dapat sila yung tinutulungan, pero they find time to help. And thank you for that. And my other team in Singapore salutes you and your group for that. And they have helped in their own little way. So maraming salamat for that. So pag gusto niyo pong tumulong, meron din pong group si Doktora, the Mu Sigma Pi Sorority of UP Manila. Sana po marami tayong natutunan that we can apply on our day-to-day activities. Remember, ito yung mga mabibilis kong napulot. The war is against the virus and not among each other. And remember the 20-20-20. I think that's very useful. Yung wala namang cost yun. Titingin ka lang sandali sa medyo malayo para maiba yung paningin mo. So kung hindi masyadong maganda yung nakikita natin, lingon ka sa kabila. I think that's very effective, figuratively and literally speaking. And do not discriminate. And I think the key word is acceptance. Tama ba, Doktora? And then, thank you, syempre, Dr. Eugene Makalinga, for ever ready na kahit isang tawag lang, you're there. Maraming salamat for joining us tonight as co-moderator and making the discussion more lively. Maraming salamat lagi. And maraming salamat din to all our friends who always help us share and promote our webinars. The Philippine Embassy Singapore, led by His Excellency Ambassador Yap. And Consul Gonar Musor is here with us tonight. Thank you, Consul. I saw you on Facebook Live. Ginagawa ko taga-bantay doon. And then Richard and Rex of FLPH, maraming salamat ulit sa walang sawang pag-share. Lynn of CDE, these are big groups sharing the webinar all the time. Eloisa of FAUS, Miss Virgie of STP FAUS Dance Group, Millet of Fast, BNG, Lila, I saw you there. Rated J, the Lucky Plaza Ladies, you're there also. FAS, or the Filipino Association in Singapore, Miss Mao and Luz, you were there. UAP, Ateneo LSE, UPAES, Precious, I saw you. Excalibur, Ernie, you were there. Kabayanihan, Jehan Bulanadi and Arvin David. This is a big group. They have members also from Middle East. So we are being watched sa Middle East din. So maraming salamat po. And allow me to say special thank you to the cargo companies who have been helping our kababayans back home together with their team of volunteers who are also watching us tonight. Nandyan po silang lahat, yung mga nag-hi na marami sa Facebook. Maraming salamat for joining us. And for quickly agreeing to help, yung isang tawag lang, nandyan kayo agad. UMAC Express Cargo with Index 1 and Excalibur, care of Ernie Estrella and Sunny Nas. Maraming salamat. A-Freight Cargo with Kabayan SG and Humankind Around the World SG, care of Richie Maniaol and Maureen Versosa, and Miss Lydia Labaco Diego. Yung nag-hello dun sa Facebook. Thank you po sa dami ng boxes, sa dami ng pinadala natin na in-kind donations to Isabela and Cagayan. And of course, LBC with Singphil Events, care of Sharon Tordesillas and Arnel Repeso. Maraming salamat, Arnel. And our team PNB, they are all here, including our officers from Manila. Thank you for joining us and for responding quickly for all the help, call for help for our kababayans back home. Siyempre, maraming salamat to all our participants in Zoom and our Facebook viewers. Don't forget to click the like button for us. And as this will be our last Thursday session for the year, allow me to greet you a meaningful holiday. And definitely, we will have a better 2021 by being mindful of our mental health. Mabuhay! And back to you, Minnie.
Thank you, Christy. Okay. We did learn a lot. We like one of those things in addition to what Christy has said was acceptance and also the importance of just listening. I think we need a lot of that as well, and patience. So that's just one of the few things that I learned today, just to keep mental health healthy, our mental health being good, not just for ourselves, but for our loved ones and friends. So that's one of the things I learned, and I hope all of you learned many things. Also, I just will repeat again, thank you to all the people who are trying to help our kababayans in the Philippines, those who suffered from all the typhoons. So I won't be mentioning them again, but thank you all. Definitely our Bayanihan spirit is alive. People in Singapore are all willing to help. As what Christy has said, one call and a lot of people would just respond positively without question. So that's a good sign. The Bayanihan spirit's alive, and we just hope and we expect that 2021 will be a better year for all of us. So indeed, This is our last webinar this year. But before that, we have a new one, that's the Cultura webcast that is being prepared. And that will be held, it's a Bayanihan Cultura Talk. It will be held on December 4. And the guest speaker is Dr. Evelyn Cabanban, who is an author, a publisher, and a professor. She will be talking about the Philippine national hero, Jose Rizal, as a poet, as a novelist, musician, composer, lyricist, and also talk about the songs of the 1896 to 1898 songs of the revolution. So it's going to be very interesting. So please join us again. Also, I would like again to say thank you to Dr. Mel and to Dr. Eugene for that interesting discussion. We all learned a lot, we enjoyed it. This is Minerva Lau, and together with the board and staff of the Philippine Bayanihan Society Singapore, we say thank you for joining us tonight and in all the past Thursday webinars that we've been holding, conducting, organizing over the last 6 months. It's been already 6 months, and hopefully we'll have a better year next year. We sincerely hope that the talks have been very helpful, useful, informative to everyone in our daily lives, especially in this time of pandemic. We all wish everyone good health and a blessed year-end holidays. Till the next webinar, keep safe, good night, and God bless. Thank you.